The scent of pine needles on a cool morning, the sweet bloom of lavender in a garden, or the earthy freshness of cut grass, these natural aromas evoke strong emotional responses, often associated with calm, clarity, and well-being. In recent years, a growing body of research has begun to validate what many have intuitively known for centuries. Nature-inspired scents can exert real psychological effects. Through the practice of aromatherapy, especially using essential oils derived from forest trees, herbs, and plants, scientists are now uncovering how these natural compounds may help reduce anxiety, enhance cognitive clarity, and support mental resilience. At the heart of aromatherapy's power is the olfactory system, which has a direct line to the limbic brain, the region responsible for emotion, memory, and stress regulation. When inhaled, volatile compounds from essential oils bypass cognitive filters and immediately influence brain chemistry, modulating neurotransmitters like serotonin, dopamine, and GABA. This makes scent one of the fastest-acting and emotionally impactful sensory inputs. Unlike visual or auditory therapies, which often require conscious processing, the right aroma can instantly shift mood, lower stress hormones, and reorient mental focus with no effort on the part of the user. Among forest-derived scents, pine and cedarwood oils stand out for their grounding and calming effects. These coniferous oils contain alpha-pinene and other terpenes known to reduce markers of inflammation and anxiety in the brain. Studies on forest bathing, Shinrin-yoku, in Japan have shown that even short exposure to pine-rich air significantly lowers cortisol levels and increases feelings of relaxation. In aromatherapy settings, diffused pine oil replicates some of these effects indoors, creating a sense of stability, emotional regulation, and even improved sleep quality. People who struggle with racing thoughts or overstimulation often find that forest-based oils create an internal reset, promoting both calm and mental focus. Lavender, long known as the quintessential calming scent, has perhaps the strongest body of clinical support. Its primary compound, linalool, interacts with GABA receptors in a way similar to anti-anxiety medications, without sedating side effects. Multiple randomized controlled trials have shown that lavender oil, whether inhaled or applied topically, significantly reduces symptoms of generalized anxiety, promotes relaxation, and improves sleep. In cognitive tasks, participants exposed to lavender often perform with fewer errors and report lower subjective stress. What makes lavender especially valuable is its adaptability. It can reduce emotional distress while simultaneously supporting alertness when needed, depending on the dose and delivery method. Grassy or herbaceous scents, such as vetiver, lemongrass, or fresh-cut grass aroma, offer another avenue for cognitive renewal. These scents often elicit a nostalgic or invigorating effect, reviving mental clarity and reducing fatigue. The smell of freshly cut grass, for example, has been shown to trigger areas of the brain associated with pleasure and memory. Some researchers believe that these scents may improve attention span and executive function, particularly in overstimulated or mentally exhausted individuals. When used during periods of focus or creative work, grassy aromas may create a sensory buffer that improves productivity and sharpens mental presence. Importantly, nature-inspired aromatherapy does not require intensive commitment or specialized equipment. A few drops of essential oil in a diffuser, a mist spray on pillows, or a small inhaler carried throughout the day can be enough to experience meaningful benefits. And because scent is such a personal experience, individuals can tailor their use to what brings them the most comfort, whether it's the clean woodiness of cypress, the energizing green of rosemary, or the soft floral calm of chamomile. As with any wellness approach, quality and consistency matter. True therapeutic-grade essential oils, derived from whole plant material without chemical solvents, are most likely to deliver benefits. Synthetic versions may mimic the scent, but lack the active compounds that influence the brain and body. Moreover, while aromatherapy is generally safe, sensitive individuals may want to test oils gradually and consult with a healthcare provider if managing a serious mental health condition. Ultimately, nature-inspired aromatherapy offers a sensory bridge back to equilibrium in a world that often feels disconnected and overstimulated. By reintroducing the healing language of the forest or the garden through scent, we can subtly influence our brain's chemistry and emotional tone in ways that are both ancient and deeply personal. Whether it's a moment of calm before sleep or a midday lift in mental clarity, the right scent can offer more than pleasantness. It can offer peace, presence, and restoration.